Hello everyone, welcome back to the ObaNutrition channel. Today in this episode, I will be sharing about iron deficiency anemia. So what is iron deficiency anemia? It is a medical condition in which you are deficient in a protein known as hemoglobin that is very essential in the transportation of oxygen. This type of deficiency is usually caused by low serum iron levels. So there is a relationship between you having low iron levels, which eventually cause you to have low hemoglobin levels because iron is very essential in the production of hemoglobin. Finally, you end up being unable to transport oxygen throughout the body. This type of anemia is scientifically known as also microcytic anemia. So which are the typical signs of iron deficiency anemia or microcytic anemia? One is paleness on your hands, which you also know it as palmar pallor. So you can just look at your hands on a mirror, or you can just look at them by yourself. Do they look pale? Do they look pinkish or reddish? If they are pale, that's a sign of iron deficiency anemia. You can also check below your eyelids on a mirror. Are they pale or are they pink? You can also check your tongue on a mirror. Is it pink or is it whitish? If it's too whitish, it also defines a sign of iron deficiency anemia. The other sign is experiencing lethargy, a lot of weakness, a lot of breathlessness, sometimes even fainting. This is because you are unable to transport oxygen efficiently throughout the body. And this mostly occurs whenever you're doing an activity such as walking or running, because your muscles during this time they require to be able to uptake oxygen for respiration in order for them to have energy for movement. So you can experience this kind of symptoms. Also, one which is not very commonly known is excessively yawning. So what actually causes iron deficiency anemia? One is low intake of heme iron or even non-heme iron, either way. The other one is low intake of copper, low intake of vitamin C rich foods, high intake of caffeine, specifically energy drinks, coffee, and tea. Also experiencing heavy menstruation during your menstrual cycle. Also experiencing a miscarriage or an abortion, because there will be eventually a lot of blood loss. Malaria can also cause iron deficiency anemia, liver disease, an enlarged spleen or even what we know as splenomegaly, renal disease of whichever kind, whether it's chronic kidney disease, acute kidney disease, nephropathy. All this can cause iron deficiency anemia. Also having leukemia, being placed on cancer treatment such as chemotherapy and radiotherapy, and lastly, whether you're involved in an accident. This can also cause you to have microcytic anemia. So when you go to a hospital, how will they be able to identify, besides the clinical symptoms that I just mentioned, of you having iron deficiency anemia? So your doctor will also can order for a full hemogram or a full cell blood count. So with a full hemogram, the doctor can be able to check your HB levels and your MCV levels, what you know as the mean cell volume. So if you're having a low HB with a low MCV, that will directly indicate you're having microcytic or iron deficiency anemia. However, if you're having a low HB but a very normal MCV, that is not iron deficiency anemia. So which are the normal HB ranges? Your normal HB should be between 11.5 to 17.5 grams per deciliter, while your MCV level should be between 76 and 100. So if both of them are very low, your doctor will tell you that you're having iron deficiency anemia. So what will most likely happen once you are diagnosed with this? So if your HB is below 9, let me start this way. If your HB is between 9 to below 11.5, so it's between 9 to 11.4, your doctor will ask you to, this is also combined with the fact that you are also having a low MCV. I want to put that also straightforward. So if your HB is between 9 to 11.4 and you're also having a low MCV, your doctor will refer you to see a nutritionist to be able to counsel you on which kinds of food or which kind of diet you should follow to be able to increase your serum hemoglobin levels. The other thing that your doctor will also do if your HB now is between 7 and 9 and you're also having a very low MCV, is going to either prescribe some iron supplements like iron sucrose or IFAS, or even place you on hematinics such as ranferon, which are supposed to be able to aid you in increasing your hemoglobin levels. However, at times iron supplementation might be contraindicated if you are having also bacterial infection, because it will cause further multiplication of bacteria, because bacteria, just as they love sugar, they also love iron. If your HB is below 7 and you're also having a low MCV, you're probably going to be having a blood transfusion and also some iron supplementation and prescription of hematinics, depending on how the transfusion will end up boosting your HB levels. If they boost to a certain point, let's say it was at 5 and it's boosted to up to 7, from then they can see if they can add another unit plus put you on some hematinics. So in terms of diet, what kind of food should you take to prevent iron deficiency anemia or even to actually treat it? Number one, you're supposed to consume foods which are very rich in iron. So there are two types of iron. There's the heme iron, which actually comes from animals, and there's the non-heme iron, which comes from plants. So heme iron is the best source of iron because it is more bioavailable than non-heme iron, and this can be found from animals such as beef, cows, goats, sheep, whatever. But specifically, you should look for the organ meats. These organ meats are the liver, the heart, the kidneys themselves. They are very rich in iron, specifically the liver, and also in other nutrients. It's kind of a multivitamin by itself. You can also eat beef, goat meat, mutton, pork, seafood such as fish, sardines or omena, poultry such as chicken, eggs, turkey, geese, and ducks. For the non-heme sources of iron, which you can consume if you are unable to either budget for the heme iron, which is from animals, or even by yourself you are subscribed to the vegetarian kind of diet, which mostly occurs among our friends who are in the 7th day. So for them, they can take foods such as beans, groundnuts, spinach, beetroot, even millet flour, sorghum flour. So if you're making your ugali, you can prepare it with sorghum flour, which is very rich in iron. If you're making your porridge, you prepare it with millet flour, which is also very rich in iron. The second thing is consume foods that are very rich in vitamin C. Vitamin C aids in enhancing the bioavailability of iron, especially iron that is sourced from plants. So ensure you are taking lots and lots of vegetables such as cabbage, spinach, broccoli, cauliflower, the kienyeji kind of vegetables such as amarantha, osuga. Also consuming capsicum, which has very adequate levels of vitamin C, tomatoes. When it comes to fruits, you consume fruits that are very low in sugar, because the higher the sugar content in fruits, the lower the vitamin C bioavailability. So consuming foods that are very low in sugar will also increase the bioavailability of vitamin C, which further enhances bioavailability of iron. So these type of fruits are like avocados, guavas. You can also take cucumbers, citrus fruits such as oranges, lemons, tangerines. The third thing you can do in terms of your diet is consume foods which are very rich in copper. Copper is a reducing agent, So it will prevent the oxidation of iron, which will also prevent sepsis or even cancer occurring, because oxidation occurring in your blood is very toxic. Let me use that word. It's not good for you at all. So copper, being a reducing agent, will also enhance the bioavailability of iron. So the best sources of copper are the organ meats which I was mentioning: the liver, the heart, and the kidneys. They are very essential in enhancing bioavailability of iron. The fourth and the last thing that you are supposed to do is to reduce your caffeine consumption. As long as you are consuming high levels of caffeine, your iron levels will remain very low, which means your hemoglobin levels will also remain low. And these sources of caffeine include the energy drinks, the coffee, and your tea. And especially energy drinks and coffee. These have very high levels of caffeine that will inhibit absorption of iron in your blood. So I hope you have learned one or two things, especially if you're someone who has suffered malaria before, or you are also on chemotherapy, or on having something like cancer, as well as if you are also having renal disease. This is a topic that you should be careful to pay attention to, because you are very prone to having iron deficiency. Also, if you are, I don't know if I mentioned this, but also sickle cell is another condition which people are very prone to having microcytic anemia. So thank you for watching this video, and see you next time. 11